Hi everybody and welcome back to my vlog. So this week I'm going to talk to you about the HPV vaccine, the human papillomavirus vaccine. And it's a vaccine that's predominantly offered to girls, but I'm going to go into that. And there's a lot of controversy about it as there are some very vociferous groups online who are making outrageous claims about it and what it can actually do. So I'm going to tell you everything about it, including what it can do, including side effects, and what you should do, in my opinion. And remember, it is just my opinion. But I am going to put lots and lots of links at the end of current peer-reviewed research that you can trust so that you can actually make an informed decision for yourself. Now, before we start, I have a disclaimer to make, which is that I have a cold, a shocking cold, and I think summer colds are sometimes worse than winter colds. So do excuse me if I sound a bit husky and if I cough everywhere, but I'm going to try not to. Okay, so HPV vaccination. Should I give it to my daughter? Should I give it to my son? There's an interesting question. So first of all, what is the human papilloma vaccine? So the human papillomavirus is a virus that's very common and it's been around for quite a long time, but we've learned lots about it over recent years and we've now developed a vaccine. It's a wart-causing virus. So papilloma means wart. So we know that there are certain strains of HPV, that's what we're going to call it for the rest of the video, that cause cervical cancer. In fact, cause 99.7% of cervical cancers. But, little known to people, it also causes vaginal cancer, vulval cancer, cancer of the penis, cancer of the head and mouth, and neck. It also causes genital warts and verrucas, and voice box warts. So there are lots of different strains of HPV, loads and loads of them, they all have different numbers, but those are the things that they can cause. So as you can see, they're quite devastating little viruses and can have long-term effects and can even kill people, and do kill people. The vaccine is effective against those that are most likely to cause cervical cancer. So who gets the vaccine? Well, at the moment, in England and Scotland, Wales and Ireland, it's free to all girls aged between 12 and 18. Most girls get their vaccine at around year 8, so age 12 to 13. So if you're a mum or a dad to these girls, you'll get a letter home from school asking for your consent. The one that we use in the UK needs 2 doses, and the doses are usually given 6 to 12 months apart. If your child is over 15, they'll probably need 3 doses, and the reason for that is that when they're older, they don't build up immunity quite so well with the vaccine. So how does it work? So in the UK we use Gardasil, that's the name of the vaccine. We used to use a different one as well, but we don't anymore. So the only vaccine that your child will be getting is called Gardasil. It protects against 4 different strains of HPV. Number 6, 11, 16 and 18. We know that 16 and 18 cause 70% of all cervical cancer. So it's massive, 7 in 10. And number 6 and 11 cause 90% of genital warts. So those are the most important strains that we can isolate and vaccinate against. So why do we choose this age, 12 to 13? Well, we know that it's best if it's given before girls come into contact with HPV, and they come into contact mainly through sexual contact. So age 12 and 13, they likely haven't yet come into contact. But having said that, it's not just penetrative sex that passes HPV, it can be spread by any skin-to-skin contact, so hands, fingers, mouth and genitals. So we think 12 to 13 is probably the right age. Most people will come into contact with HPV in their lifetime, but they'll just clear it, their immune system will do the job. For some, however, that doesn't happen, and this is why some people get warts and some people don't. Some people get cold sores, some people don't. It's about your immune system clearing the virus. So does it work? The most important question of all. Well, the vaccine was introduced worldwide about 10 years ago. So the figures that we've got coming through obviously will take time, because it will take time to see the effects of that. However, for example, in Scotland, Health Protection Scotland has issued their figures already, and they have found that there is a 90% drop in levels of HPV that's being carried by Scottish women since the vaccine was introduced in 2008. 90%. So that's 9 in 10 women who would have been carrying a potentially life-threatening virus that could give them a cancer that kills and does kill are no longer at risk of that, or certainly of those strains. So that's 70% of the cervical cancers. Clinical trials are already showing us categorically that it is 99% effective in preventing the precancerous cells that are caused by the HPV 16 and 18. Those are those cells that when you have your smear test and you get that terrible letter saying you've had an abnormal smear and you've got abnormal cells, those are the cells. And this is 99% effective at stopping that from happening. So think of the joy of getting a smear and it always being normal. It's expected to reduce the most common cervical cancer that we see by 70%. So that's 7 in 10 women who won't get a cancer that they were going to get because of this virus. So yes, it works. Now what about boys? This is a question I get asked all of the time. So boys might not get cervical cancer. In fact, they definitely don't get cervical cancer. But they do get cancer of the penis, the anus, the mouth and neck and throat, and they do get genital warts. Boys are not being vaccinated by the NHS, by the government. This isn't because it doesn't work, it's because it's not viewed as being cost effective. So for the number of vaccinations that the government would have to give and the number of cancers that would be prevented, they have decided that it's not cost effective. That doesn't mean it doesn't work, it does. In fact, men who have sex with men are offered the vaccine free of charge up to the age of 45. Trans women who are men having sex with men are offered the vaccine free. And trans men and women who are having male to male sex are offered the vaccine free. And that's perfect, it's great, it's exactly as it should be. But at the moment our boys are being excluded. So the question is, should you give it to your boys if you're a parent? I can only answer that in terms of the evidence that I've seen and what I would do. And I would. It's low on side effects. You have nothing to lose by giving them the vaccine, but you can present a later life cancer for your boys as well as your girls. So yes, I would give it to my boys if I had them of the age where they needed it. As you know, my boy is now a grown-up boy. So I think I'd have to bully him into doing that. But I will suggest it to him that he has it done, for sure. So is it safe? And this is where the controversy comes in. So these are the answers, and these are researched, peer-reviewed answers. There have been 80 million vaccines given worldwide so far. 80 million. That's a lot of vaccines. It's being monitored all of the time in countries like Australia, America, Canada, all of Western Europe, including the UK. It's being monitored by organisations such as the Centre for Disease Control, the World Health Organization, the EMA. All of these people are monitoring it constantly for safety. And every single one of those organisations has proven that this vaccine is safe. There are side effects, of course there are. There are side effects to every medication or vaccine that we have, including the paracetamol that you give your kids on a daily basis. There are side effects. So these are what they are. So very common side effects, so 1 in 10, is redness, pain and swelling at the injection site. It's temporary and it goes away after a couple of days. Headaches. Young girls seem to faint sometimes after having it, so we get them to lie down for 15 minutes after the vaccine. Less common, 1 in 100, nausea, bruising, itching, a slight fever and pain in your arms, hands, fingers, legs and feet. Again, these are transient and they go away, and they're much less common, only 1%. Rare, so 1 in 1,000, hives. So just a slight allergic reaction. So 1 in 1,000 people will get hives. Very rare, so 1 in 10,000, difficulty breathing. This is very rare. And then, as I said, there's these reports of fainting or dizziness, swollen glands, seizures, anaphylaxis, bruising and bleeding. But there are no figures on these because they are so very rare, the anaphylaxis and all of that. So all in all, the side effects are minimal, they're transient, they don't last, and you're protecting yourself or your child against a cancer. So even the media, who are always very sceptical about vaccines, agree. And I found some articles for you across the media. The Daily Mail say that the vaccine is safe. I wrote an article in OK magazine answering Melinda Messenger, who said it wasn't safe. There's an article in The Guardian that say that it is a completely safe vaccine, so why are parents not giving it? I'm going to put links to all of these articles in the comments afterwards so that you can read them for yourselves and decide. But still, despite all of this information, there are loads of rumours about it not being safe, and I'm going to cover those. So there are rumours that it causes premature ovarian failure. It was a rubbish sample. I cover it in the Melinda Messenger story in OK, so please read that. It's a nonsense. It does not cause premature ovarian failure. There are other stories that it's linked to chronic fatigue, postural tachycardia syndrome, or POTS, Guillain-Barré, complex regional pain syndrome. Now, just to tell you that the flu vaccine is linked to Guillain-Barré as well. And there have been the very, very rare, it's something like 1 in 1 to 2 million cases of Guillain-Barré from a vaccine. So those are the kind of figures we're talking about. But in terms of all of those claims, and if you go onto the internet, you will find these claims, and they are fairly vociferous and really scary, especially as it's your child, and I completely get that, but they're completely unfounded. So the World Health Organization has looked into all of these claims, and they have found no evidence at all of any increase of those illnesses in people who've been vaccinated with HPV versus those who haven't. So what they're saying is that you're as likely to get one of those things if you haven't been vaccinated with HPV as if you had. In other words, the vaccine does not cause them. If there are cases of people that have these things, it is coincidence and nothing more. The WHO Global Advisory Committee on Vaccine Safety issued a statement in this in March 2017, and I will find a link for that and put it in the notes for you afterwards. And I will also put links to all of the other studies that prove that these claims are unfounded. It's really important. Women die of cervical cancer every single day. I have seen women as young as 40 die of a nasty, horrible cancer that leads to a horrific death. Jade Goody died. So in summary, it is safe. And I'm going to say that. You know, I quite often give both sides of any story, but in this case I'm going to say it is safe. It protects boys and girls. It is, however, only offered to girls, men who have sex with men, and transgender people under 45. You can, however, have your boys vaccinated privately. I would if it were my boy. Side effects are mild and rare, and they pass. Cervical cancer rates are going to be reduced by at least 70%, and cervical cancer kills. And the acid test is, if I had a girl, would I have her vaccinated? Well, some of you know this and some of you don't, but I'm currently 7.5 months pregnant with a little girl, and I've already discussed this with her dad, and we are definitely going to let her have this vaccination. And I can say that with hand on heart, I will have my little girl vaccinated against HPV, because I don't want her to get cervical cancer or any other one of the other cancers that can be caused by HPV. So that's my blog for today. I hope that it's answered all of those questions, because I know this is a difficult topic and I know it's emotional when you're having your children vaccinated, because you don't want to hurt them, of course you don't. But on this occasion you'll be helping them and protecting them. I'm going to put links to all of those media articles and to all of the research that you can trust. So research that is proper, validated and has a basis. And I'm going to put all of those in the comments afterwards. So please do have a read and make the decision for yourself. and I hope this has helped you just sort the wheat from the chaff, as it were, because it's a difficult and emotional topic. So thank you again for watching. As ever, I really, really appreciate every single one of your views, your subscriptions and your comments, and tell me anything you'd like me to cover for the future. Thanks again and have a fabulous week.